Hi everyone. Thank you so much for coming to the conference. I know it's a very exciting time. Yeah, I am really, really grateful to be speaking in front of an audience of so many business owners and entrepreneurs doing great things within their respective industries. My name is Dr. Colin Zhu. I am a board certified family medicine and lifestyle medicine trained physician. I'm also a chef, speaker, and author. And I help busy achievers attain joy from their life goals without sacrificing a lot of resources and, more importantly, their health, because people deserve to thrive from optimizing their entire well being. Working. So I define overworking as an individual's threshold from going over the edge. And in this society, in this busy, busy society where everything is conditioned for pain is no gain, work until the wheels fall off, we need to be able to get back to our internal cues, to our internal body cues, to really understand what our body is telling us so we don't go over that edge. A lot of us are working 8, 10, 12, putting in 60, 70, sometimes 80 hours a week. And when we get to that certain type of point, we don't really realize that time has gone by and our body is already signaling us that we have overworked. Overwork can be defined, and a lot of signs and symptoms can indicate different things from brain fog to fatigue to heart palpitations to GI upset, stomach upset to even just holding your urine and not going to the bathroom when your body is telling you. So these are many, many different types of signs and symptoms that we need to do a better job of being more mindful to pay attention, because we have been in this environment and society and conditions where we don't pay attention to ourselves. We have to rely on external cues like our smartphones, like our clock, like our watches, when we need to continue to be more mindful and practice and paying attention to our own body cues. So, from lifestyle medicine is a profession of using evidence based lifestyle approaches to prevent, treat, and reverse chronic lifestyle related diseases. For example, heart disease, diabetes, certain types of cancers, thyroid, obesity, overweight issues. You may be battling with this yourselves. You may know of someone you love battling with this as well. And the impact is very, very great. If you look at the top 10 causes of death in our country as Americans, 7 out of 10 is related to diet and lifestyle related causes and risk factors. And so what we do know is that up to 80% of this can be prevented. 60% of Americans carry one chronic medical condition or diagnosis. 40% of Americans carry two or more. It's not uncommon for a patient to walk through my doors and have a long list, a long laundry list of medications. And we're finding that younger and younger and younger demographics and patients are suffering because we are not paying attention to our body health. We live in a system where it doesn't set us up for success. And we also rely on a healthcare system that is more reactive than proactive, meaning that when something goes wrong, we intervene. And I get a lot of patients that only go to the doctor when they feel sick or when they don't feel that great. When it needs to be in reverse, we need to go in a proactive, preventative manner to be able to get things going. And I like to use car analogies. You don't service your car when it breaks down, right? We need to service our cars all the time to maintain because we want it going for the long haul. So if you think about your bodies like a car and you only get one car, you want to be able to maintain that for a very, very long time. So just like a car where you rotate tires, you change oil, you change your air filter and all these different things, we want to be able to do that, for our body, for our physical health, emotional health, and mental health. So not only going to your regular and primary care physician to do checkup, blood works. That's one part of it. But the other part is really exercising the pillars of health, making sure you put in nourishing foods into your body, sleeping well, moving your body several times a week, optimizing your relationships, social connections, optimizing your self care, avoiding and minimizing, ideally avoiding toxic, substances and risky behaviors, and just making sure you're well hydrated. These are the pillars of health that we continue to emphasize. We draw on the scientific literature to really hold people accountable. I myself do this every single day, and I want my patients to optimize their health in that way as well. So, lifestyle medicine is great because it holds people accountable. Okay. I cannot tell my patients what to do if I don't do them myself. So, for example, I go for morning walks, I go for runs, I, take classes to dance. I make sure I go to bed at a reasonable hour, and I wake up at a reasonable hour, and I get 7 to 8 hours quality sleep. I am whole food plant based, and I eat a lot of, enough servings of vegetables and fruit. 1 out of 10 Americans don't get the recommended servings of vegetables and fruit. 97% of Americans are deficient in fiber. Okay. So this leads to several different things like heart disease, imbalances of your cholesterol, overweight issues, high blood pressure, heart disease, and different types of, cancers. 71% of Americans are overweight, 40% of Americans are obese. And this has rippling effects, not just for yourself, but productivity. Okay, the number of hours that you call out from work, and this for a business owner and entrepreneur is very detrimental for their bottom line. So instead of paying so much money for all these different medications, and hospital visits and ER visits, we need to shift and refocus on how we invest in ourselves. So putting those dollars, and saving it and investing in ourselves by, putting in the right foods, moving, physical activity, emphasizing quality sleep, emphasizing high quality relationships and social connections. These are all important, and we can't overemphasize this, because it helps to be on that preventative and proactive track. So a lot of research, tells us that sitting for 6+ hours a day is the new smoking, because what happens is that you're building up a lot of chronic inflammation in your system. The human body is not meant to sit for very long, for long periods of time. We are meant to be nomadic. We are meant to move. We are meant to exercise our muscles, our joints, improve and help our circulations to move. Okay, get our metabolism going. Okay, exercise our bone health. A lot of great benefits come from physical activity. So my recommendations, with my patients, with my clients, with my coaching clients, with people that are coming to see me, is if you are at an office or cubicle, is to set an alarm. Okay, that on the hour, every hour. Okay, you just get up 5 minutes, do a quick stretch. Okay, do some head rolls, some neck rolls. Okay, do some shoulder rolls. Okay, do some back rolls. Okay, and to get the blood flowing, do some jumping jacks. Okay. Very simple. Do some push ups. Okay. Do some air squats. The biggest muscle groups are your back and your legs. And so a lot of that is hurt over time when we're sitting, even standing for very long, even if you have a standing desk, which is good. Okay. Getting up, moving around on the hour, every hour is a good practice. Okay. If you have a standing desk, switching from sitting to standing and then standing to sitting is also good. Okay. You want to be able to vary it up. Okay. And, we need to exercise your glutes, your hamstrings, your leg muscles, your butt muscles, and your low back. We need that fluid because it's going to atrophy, which means breakdown. And you're going to be in a condition where you're going to lose muscle and your cardiovascular health will go down if we don't pay attention to this. So, like I said before, it's really the pillars of health, putting good, nourishing foods in your body. My general recommendations is to be more plant forward, to eat more vegetables and fruits, because your optimum nutrition actually comes from plant food. Your vitamins, your minerals, your phytonutrients, your antioxidants, your fiber, all these are coming from your plant food. Like I said, 1 out of 10 Americans are not getting enough and 97% of Americans are deficient in fiber. This leads towards heart disease, diabetes, cancer, overweight, being obese. This affects your gut health. Okay, your microbiome. 70% of your immune health is in your gut. So it all depends on what you put into your system. This makes a lot of sense and is very determined whether you're going to contract COVID or not, whether you're going to acquire all these different viruses that are floating in our environment. Okay. The people who get COVID actually are the ones that are suffering from lifestyle related chronic illnesses. Like I said, heart disease, diabetes, cancer, they're all the same thing. Okay. So the more that we can reduce this inflammatory burden on ourselves, the better. Okay. Optimize your quality of relationships. There's a study put out by the Harvard Adult Development Study, 75 plus year study, one of the longest studies, that says that the positive predictor for your health and longevity is really determined by your high quality relationships. So you have to optimize your relationships with your loved ones, with your friends, with your coworkers. Okay, making sure that you're in an environment that fosters and supports that, making sure that you're in a community. Okay. The blue zones are the highest concentrations of people living over 100. And the biggest takeaway from that is really their environment. Their environment fosters and helps supports healthy behavior, lifestyles. Okay. Making sure that you're not alone. If you are a business owner, if you're an entrepreneur, it can be a lonely journey. I know this firsthand. So making sure that you are with other people in the like-minded space and in that community, it's super, super important. If you guys want to learn more about me, you can find me on the Chef Doc right behind me on .app. App. We have a website. We're on all social media platforms. We have coaching services. We have an on-demand app, and give me a your time for a 15-minute discovery call and let us know how we can help you. I wish you much success for this conference and much success for your businesses. And thank you so much for watching. Take care, everyone.